Burkitt's lymphoma. If you are a caretaker of children, especially in Africa, this video is going to be very important for you because this Burkitt has claimed a lot of lives of African children. By the end of this video, you are going to learn what Burkitt's lymphoma is, what are the signs and symptoms of Burkitt's lymphoma. In other words, when should you suspect that the child under your care has Burkitt's lymphoma? What you should do as a caretaker if you suspect that the child under your care could be having Burkitt's lymphoma. And then at the end, I'm going to share some good news about this Burkitt's lymphoma. Make sure that you watch this video until the end. My name is Dr. Emmanuel Amukun from Marvel's Dental Hospital. So let's dive in. What is Burkitt's lymphoma? Burkitt's lymphoma is a high-grade, rapidly progressing form of human cancer that tends to affect the facial bones, most especially the mandible. And this is common in children. The cancer is named after a British surgeon called Dennis Burkitt, who first identified this unusual disease among children in Uganda in 1956. And the type that we are talking about today is the one that tends to affect the children mostly in Africa. The one which is called endemic Burkitt's lymphoma. There is also another one called sporadic, which we are not going to talk about, which is in any other part of the world. And then we have the one which affects immunosuppressed people, like AIDS patients. That also we are not going to discuss today. In this video, we are going to focus on the endemic one. This cancer has a very strong association with malaria and Epstein Barr virus. It is thought that a malaria attack weakens the immune response to Epstein Barr virus, and this will allow the virus to alter the immune cells of the body, resulting into this cancer. And that is exactly why it tends to occur in children who have had a recent malaria attack. So how do you know, or when should you suspect that possibly the child has Burkitt's lymphoma? And we are talking in perspective of the caretaker. In other words, what are the signs and symptoms of Burkitt's lymphoma? For you as a child caretaker, the child will come complaining of a toothache. Usually, this offending tooth is associated with swollen gums, and the tooth or the teeth could be shaking. And when you check closely, the tooth or the teeth do not have any decay on them. They do not have cavities. Even though having cavities is not an indication that the condition could not be Burkitt's lymphoma. But having a mobile tooth or mobile teeth with swollen gums is a very high suspect case of Burkitt's lymphoma. The swelling of the gum will tend to progress abnormally faster, and it is usually rubbery in nature, and it does not contain any fluid at all. And if this swelling is left untreated, it will continue to grow at a very fast rate. And that is the most common and reliable sign of Burkitt's lymphoma. The other signs and symptoms will include loss of appetite, night sweats, unexplained fevers, and difficulty in breathing. If this tumor is left untreated, it will eventually lead to the death of the child. So what should you do if you are a caretaker and you suspect the child has Burkitt's lymphoma? Well, the best you can do is to take this child to a dental clinic. Why a dental clinic? Is because most of our colleagues who are non-dentists may not understand this very well. So the best thing is to take the child to a clinic with a qualified dentist. The dental clinics themselves usually cannot manage these cases. But the good part is that they are the ones that can link you to the right facility where the child will get adequate treatment. And with the timely treatment, then the outcomes are favorable. And that brings us to the good news. The good news is this. But before we go to the good news, if you like the information you are getting from this video, please make sure that you give it a thumbs up. And if you haven't yet subscribed, please hit that red subscribe button right now, and then we continue. Thank you for doing that. So the good news is this. Despite its fast-growing and fatal nature, Burkitt's lymphoma is one of the most curable cancers. In fact, more than 90% of the children who have a localized tumor, that is a tumor which is just in one area of the jaw and they have not spread to the rest of the body, are curable if they are treated on time. And more than 85% of the tumors that have spread to the other areas of the body can still be cured. So with timely treatment, the chances of complete cure of Burkitt's lymphoma are very, very close to 100%. But please, make sure that the child gets into treatment early enough. Do not try to take chances with the life of your child by trying some home remedies, because this is not treated using home remedies. The treatment of choice is chemotherapy, and it responds very, very well to that treatment. If you like the information in this video, then you might also want to get answers to other children dental conditions, including things like how to prevent tooth decay in children, how to teach children how to brush, teething problems, false teeth or a vinyo, and all those other things. And good enough, I have organized all those videos into this playlist here. So make sure that you check it out, and I'll see you in the next one. Take care of the children.